Dr. Crocker here. Give me a thumbs up if you can hear me, or a wave. I tried to pick the one spot in my house that had the best Wi-Fi, so I'm hoping the connection will work the entire time, so that you can hear me and you can listen and see and all the things. I'm so excited to see so many people on here that I wanted to see. Welcome, welcome. Yay, love the thumbs up. Keep it coming. I am pumped. I'm just giving everyone like a little bit of time to get on, and then I will get started for the first extra credit with Dr. Crocker. The name, by the way, I have to give a shout out to the Happy Vet because she totally helped me with the name. She's amazing, and she also has a big heart for veterinarians, so you need to be following her because she put out a great kind of pandemic stress PDF survival recently, so you need to definitely check that out. I'm glad you guys can hear me and everyone is joining. Okay, so fun fact, I spent an hour last night creating a PowerPoint with my plan, with everything that we were going to be doing, the things I wanted to focus on, what I needed you to do, because this is a collaboration. This is not going to be just me all the time. And then I realized this is an Instagram Live. So guess what? I can't share a PowerPoint with you other than to show you the PowerPoint. And that's kind of weird too. So what I'm going to do is I'm going to email out the PowerPoint that I'm going to go over today, just so you guys can see my plan, kind of what I want you guys to be doing, what I need input-wise to make this work. But I will email you, and then you can have it. And I'm also going to use email for some of the handouts I'm creating. I've had requests for the most used suture patterns, and so I'm doing that and when I would use them and kind of the little things I think about when I use the certain ones. I also am going to create an antibiotic sheet, and it is not going to be a mechanism of action pharmacology one, because I will tell you I do not remember half that stuff. It is going to be more, okay, if you have a first time urinary tract infection, you're worried about the urinary system, these are the antibiotics that I would most likely go to as a general practitioner to treat A, B, or C, and these are the considerations for those antibiotics. So give me a thumbs up if suture pattern and antibiotic use sound good. And also, if you have other ideas, I would love to see you drop them here, of just short little things that I could cover that I use frequently as a general practitioner and as an emergency veterinarian. So let's get started, okay? Couple things. For participation, I definitely want to make sure that people get something. So occasionally I will just pick random people and be sending stickers to you during this horrible time. And that way, you just have a little something as a reminder of just us meeting up, and also just know that I care about you. So first off, let me introduce myself because some of you may not know me. And this is part of my PowerPoint, which I'm looking at and advancing myself. So I'm Dr. Crocker, and I have been a practicing veterinarian for 11 years. I graduated from Texas A&M University, 2009, and I have been an equine intern for a year. I've done equine ambulatory. I have done relief veterinary work, and I am currently a general practitioner and an ER relief vet, okay? I also, for the past year-ish, have gotten into writing, speaking, and traveling, and I love it, and I enjoy interacting with students, and I've really found a passion and a heart for students. So when all this craziness started happening and all of you guys didn't get to go to school anymore, and you had to find other ways to learn, I know your schools are doing such a good job of trying to teach you the things that they were going to teach you anyways and to interact with you. But I just thought, you know, it might be a really good time to reach out and let you know that I think this is a really stressful, hard time, but I think we can use this time to make you a better candidate for that next job that you're going to get, to make you a stronger student for when you enter clinics and you get back to work there. So I want to focus on a couple different things with these classes. So number one is going to be soft skills. Does anyone know what soft skills are? If you know what soft skills are, drop it in the comments. There's a couple I think are vital, and I will tell you as a veterinarian, I am not the smartest. I am not the best at surgery, but I think my soft skill set is very strong. And I think that that is the thing that will make you a great veterinarian and give you a really good foundation to be confident, to have clients trust you and appreciate you, and to be able to get them to buy into what you're recommending diagnostic and treatment wise. So soft skills are going to be a huge focus of what I want to talk about. And I think there's a couple different ways to do that, okay? Yes, Dr. Zen is coming in with the answer. Client communication is huge. Empathy, yes, Vet Caitlin, I love it. Nonverbal communication, 100%. I love all of these answers. Critical thinking, yes. Not always following, this is what I have to do. Thinking, what can I do? Working with the client, with their restrictions, with everything that's going on with them emotionally. You have to take in the big picture, and that is part of soft skills. You would love to be able to say, this pet is having this problem, and I just need to do A, B, and C. It is never, ever, ever that black and white, ever, okay? There's always so many other things that go into you making recommendations and teaching. Sierra Smith, I love that. Teamwork, yes, 100%. As a veterinarian in a practice, you will be one of the leaders of that practice. You have to know how to help contribute to the culture and make a better culture for you and your team. Because you, even as a young associate, you will be a leader, and you should be a leader. You should go into there saying, I'm coming in here, I have something of value to offer, and I'm gonna make this practice better by being here. And so those are the things that I want to help you learn how to do, and how to do with confidence. I think if we practice these things, we can increase your value and we can increase your resiliency, because you're gonna get through this pandemic and you're gonna say, I got through this and I handled this. And I think that I actually might be stronger because of it. And I think I might have learned something from it. So that's the goal. And I really hope that it is something that you guys buy into too, because I need interaction. So I think for soft skills, we are going to do case-based ones. And this is where I'll probably do some Zoom meetings, because we're going to work through scenarios, and I'm going to maybe need to show you different, scenarios on the computer, just so you can read through them and you know what we're going to talk about. Everyone's waving and I love it so much. Hi guys. So case-based, so it's gonna be real things that have happened to me in practice and the way that I've managed and handled them, hopefully with empathy, with communication, and even when I've messed them up. I want you to learn from my mistakes the past 11 years. I want you to take something away from this that you would have had to learn the hard way, and maybe say, okay, that's something that it's gonna be in the back of my mind from now on until I join a practice. So that Life, yay, she's on here. She was the first podcast I ever did, and I am so appreciative that she gave me the chance to get on there and speak about mentorship. So adore her. Oh, my sister's on here, Jessica Fry. Hi. I hope you're watching with my nephews. I love family support. It's amazing. So the other thing with soft skills is going to be just topic based. So in general, especially after what's going on, I think finances and discussing treatment plans with financially strapped owners is going to be very difficult. I think you're going to have more financial euthanasia choices that are going to occur in practice. And I really think that learning how to recognize that post-pandemic, there are going to be maybe some considerations in the way and what people are able to do or want to do is very, very, very important. So we're going to work on some just overall general topics and how you can communicate better about those topics. Managing mindset, big one. I think that one of the reasons I love what I do still is because I go into work with a certain mindset, and I definitely try to focus on the good and not the bad, and not let that one bad experience maybe during the day take away from the 20 great ones that I had with other clients. Oh, it might get weird to hear Dr. Marshall, amazing cat class, love it. He actually really helped motivate me to do this. I don't know if he realizes that, but I adore him. Collaboration, not competition, 100%. I work in a practice and there's 3 of us, and I also work in an ER, and there's always a ton of us and we collaborate. It is a team effort. It is not competition. And I really, really think that's important. And I think there's ways to foster that where you communicate about cases with each other and you help each other through things. So we will definitely talk about that. Road to DVM is here. Yay! I adore her also. So managing mindset, explaining your value. So I do think that value is going to be really important. And I talk a lot about this in my talks with students, and all the students say, but how do I know my value? How do I know what I can offer? So I'm going to help you work through that based on what soft skills you have, based on what clinical skills you have, based on personality-wise, what you think you can bring to a practice that maybe is missing already, and those traits that we can grow and develop. So again, whether you're going into third year and you're going to be doing clinics and externing so you can be the best extern there is, or whether you're looking for that job or you're entering a job already, or you're a brand new veterinarian, we're going to work on ways that you can do better, okay? Now, clinical skills, I kind of already talked about going over some basics there. Definitely surgery tip basics too, because I think there's some things that are kind of learn as you go, and I want to try to give you those things early on so you can start thinking about them. For things like suture practice, I can give you the patterns that are most common. I don't know if you want any tutorials on me doing them and the things I think about, but I was more going to do PDF on the ones that I use most frequently in practice, when I would use them and why I would use the different ones. So tell me if you want more of a visual, because I can definitely film doing sutures. I mean, I suture all the time. Or if you just want something that's like a handout. And then the other thing is personal growth. And we kind of talked about that already. Finding your value, navigating the unknown, which we are in the unknown right now. This is the unknown and it's crazy. Finding mentorship in practice, how to do that, what that looks like, whether you're, again, looking to shadow, extern, or even just online, reaching out to people, because there's a lot of veterinarians on social media that are very, very open to helping students and are very concerned about students right now, because I can't imagine being a student and having things just stop at school and going home and trying to learn online. I would really struggle with that. And I am a pretty push through it, get it done person. So if you are struggling right now, if you're stressed right now, 100% normal. Okay. That's why we're here. We're here to help each other through this. And as a veterinary professional, you will have people that are there to help you through your career the entire way. So learn now that we're here for each other and we want to reach out and help each other. Okay. If you agree, let's get a little hands up, 100, okay? We're all here for each other, okay? Now, the other thing is I want to talk a little bit about, again, my failures and how I have learned to give myself grace in practice, because none of us are perfect, and what that looks like. Because despite everything that we're doing, you've already been shown that life will throw you curveballs. It will throw you curveballs in practice, and we have to learn how to handle those curveballs, take them in and say, that actually really sucked. That was really, really horrible. But guess what? I'm still here. I'm still alive. I got through this horrible experience. I got through this horrible day, and I am going to come out of it stronger and better. And I will make it through this. And that's my main goal, is to let you know we're going to make it through this. And maybe if we work together, we can make it through it a little bit better and stronger. Okay, so that's the goal. So next thing is, what do I need from you? Because this is going to be collaborative. This is not just going to be me talking to you every time. And I appreciate everyone commenting on here, because it's good to know that I'm being heard and you agree with me and we have the same mindset and focus, because it's going to make this so much better. So I need to know from you what specifically you're stressed out and struggling with. I've had a lot of great emails of people saying, hey, I was going to start a new job. They're now wanting to start me a couple months later, or I'm still looking for a job and I'm not sure what to do about that. Or my clinics, all my externships, everything is not happening right now. What can I do? So if there are things that are very specific, I know some people are really struggling with online school and learning, and I would be the same way. I am a in-person, ask questions, visual learner, and sitting at a computer and watching a computer screen would be really, really hard for me. So I do think there's some things that we can help each other with on that, because maybe someone else has found some keys to that. I do know, is it Adriana. I think it's Adriana. I'm not sure. She's at A&M. Yay! But she says lack of hands-on experience due to clinical year being online. I think that is really, really tough. I know that as soon as we're able to, I'm hoping to like get students back in our clinic, and we still have externs that we're planning on having in a couple months. Shout out JC. But I do know that that is going to be something that's going to be harder for me to help you with. And I do think that for most of you that were fourth years and you are about to graduate and enter a job, I think that your bosses or whoever you're working with is just going to have to be aware that you didn't have as much hands-on clinical experience. And that is where you're going to have a good mentor, and you're going to have somebody who is willing to hold your hand a little bit extra and give you that little extra time to have those experiences. I do think there's things like going and doing a spay and neuter. They have like things at the shelter. Yes, I'm going to tell you that will be very practice dependent, because some practices carry certain medications and some are more comfortable with some versus others. So I can walk you through the basics that I use in the ER, because it's definitely different for like emergent struggling pets versus pets that are like routine spays and neuters. And we also do a lot for the animal shelter, and so I do quite a few of those on a budget, and so that one is different too. So I will work on a PDF for that. I will definitely write that down when I get done. So suture patterns, antibiotic protocols, and anesthesia protocols, the ones I use, I can share with you. I will not speak to all of them because it's your comfort level and it's what medications your practice has. Dr. Shauna, any advice for vet students starting in the fall, transitioning to making friends and study tip? Yes, be yourself. Don't study all the time. Have fun too. Do like the social networking things, and you will find some of the greatest friends that you will ever make in veterinary school. Go into it. I know it feels like high school at first. Oh, okay. Funny story real quick, if that's okay. So we had to stand up and like introduce ourselves in vet school the very first day. And my name is weird. It's Tanasia, my first name. And so I'm like, oh, my name's Tanasia Crocker. Tanasia like euthanasia. Y'all, I said euthanasia. Like the very first meeting with everyone in my vet school class, everyone died. They're like, you maybe should not use that as your example when you are starting to learn to be a veterinarian. Like euthanasia is not a good one. So since then, I have done Fantasia. Agree. You definitely should enjoy your summer as much as possible right now, because vet school's hard, okay? Being a veterinarian's hard. This is like one of the last summers that you just get to like be a student who doesn't have to stress as much. So enjoy it. Dr. Katie agrees with me. Examine a distance. Yes. Respiratory rate, limping, so many things, back pain, neck pain. I can diagnose those things just from looking at them in the room. So definitely look at that. Any advice for third year? Supposed to start fourth year next month. Ooh, I do think if you're starting fourth year, that's usually you're starting clinics and rotations. So again, these soft skills where you improve your confidence, you learn how to work with a team, you learn how to ask the right questions, how to read people, how to break bad news to people, how to discuss finances. I think a lot of that is really, 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 really important as a fourth year. Going into fourth year, you should have no shame in asking as many questions as possible, putting yourself out there and trying things as much as you can. So I think that we'll work on that and hopefully gain you confidence. And maybe there'll be a couple things that niggle in your brain when when they're asking you questions in clinics. But you definitely can do this, and it'll be amazing. And just know not everyone has answers. 100%. Not everyone has answers. I don't have all the answers. And you may ask me something and I'll say, that's a great question. You should look it up and let me know. And that's because I don't know. And so I want to learn also. I learned something the other day from a 4th year that was actually externing at our emergency clinic. And I will share that little tidbit with you. But I've been out for 11 years. So you guys honestly are going to know some stuff I don't know. And that's the great thing about collaborating and working with younger students and younger veterinarians. Eddie's here. Yay! He always gives me amazing input on cases. I will continue some of my cases on Instagram. You should definitely go through cases on my highlights and case 2s on my highlights and my what would you do's, because I will be covering some of those. So that might help you get the right answers, or it might just help you in general. But a lot of my stuff is not planned. A lot of my stuff is as it comes and as it happens. Dr. Shauna, did you go to vet school? So I was lucky. I went to Texas A&M for undergrad and vet school. Yes, I will save the live. I saw that. Sorry. I think if I know how to do that, I think I do. I went to A&M for undergrad and vet school. And so it was a lot easier for me, I think, than someone who's moving into a completely new experience. But what you need to realize is a lot of people are moving into a completely new experience. You're not the only one. So it's normal to be homesick. It's normal to not know where to go, but you're going to have students in your vet school who went to undergrad there and are more familiar with the area, the campus, university. We that had gone to A&M actually did a couple events where we took students out and showed them the best place to get nachos and a beer, the best place to go dancing. And we just kind of made it a fun, let us show you College Station. So I would definitely reach out as much as you can to your students that are familiar with the area, because they're definitely going to be more comfortable. And then just stay in contact with your family and your support system. Don't get lost in the books and the studying. Keep a part of yourself separate from school that fills your cup, and that is your encouragement team and your people, okay? People in school and people out of school. I think I'm going to wrap it up unless you guys have any other questions. I was going to do a case real quick, like a what would you do? So I don't know if anyone is interested in that while we have a couple more minutes, or if you guys are ready to go. Do you want to do a quick what would you do or not? Yes? No? Thumbs up? Thumbs down? You gotta go? People have left. So I'm wondering, no one's putting anything on it. Oh, I got a thumbs up. Okay. 1, 2, okay. 3. Okay. I had a couple that I was thinking of, but I guess, okay, let's do this one. So a human doctor presents a 12-year-old Labrador to you. They are looking for a second opinion because the dog has had a large swollen toe for a few months and it has been treated with antibiotics. The toe is very swollen still, and the owner is concerned because they don't feel like they understand really what's going on. The communication hasn't been great, and they want to know their options. Now, to top it off, this human doctor took x-rays of the dog's foot and toe for you and has their computer laptop and brought it in, and they want to show you those x-rays, and they want your second opinion on the pet. So my question is, do you look at those x-rays? What do you tell the human doctor? And what are your thoughts on that? I will tell you, I've had people that are actually working in labs, they've brought ear smears into me. They've come in saying, I did an ear smear and this is what I found. I've had people run urinalysis on their own pets and brought those in. And if it's something that isn't brought in that I can't see, oftentimes I will do it again, no charge. So I will do the ear smear again or do the skin cytology again just because I want to see it with my eyes. But the majority of the time they were correct about what the findings were. So it's kind of interesting. But what do you do about this owner who's presenting, that's a human medical doctor, took x-rays of his dog's foot and is bringing them into you, wants you to interpret them, and wants a second opinion on why the foot is still really swollen? Do you look at the x-rays, yes or no? I need thumbs up or thumbs down on it, or some comments or something. Just for a minute, I'll give you a second to respond and tell me your thoughts and what you're thinking on that one. And they were very nice. He's a very nice man. He was very just confused, upset, worried. I love these answers. Yay, Dr. Smith's in the house. Dr. Is it Camo? I want to make sure I... Okay, y'all have really good thoughts here. So, when were the x-rays taken? Number one question, okay? I definitely looked at these x-rays and there was severe periosteal reaction in the digit, maybe a little bit of osteomyelitis. It looked ugly, And they were taken 30 days beforehand. And I was very open and honest with him and said, listen, this could be cancer. It could just be a really bad infection. But I really think we should retake an x-ray because we need to see if it's changed a lot in that amount of time. I also looked at the records. So important with second opinion to get records in. This dog had been put on antibiotics twice, and it was put on Clavamox, and it was put on Clavamox for 10 days at a time. Would Clavamox be your antibiotic of choice, and would that be the duration that you would want to do? I'm going to say no. So what other antibiotic would you think about, and what duration? Oh, Dr. Camo. Yes! Yes. So retake x-rays of the foot and retake x-rays and include chest x-rays 100% because I'm worried about cancer. So I did do both those things. This man was very nice. He appreciated me looking at the x-rays he brought in. He understood the need for more x-rays. Chest was clear, no evidence of metastasis. Still a very ugly toe, okay? And basically what he wanted to know is what would be your recommendations and what would be the dog's quality of life based on the different possibilities. I would tell you the toe still looked very lytic to me, but it didn't look dramatically worse than 30 days before, and the chest x-rays were clear, okay? So this toe was painful, but what we talked about for a while was his goals, and that's what you need to do. You can say, hey, it's really painful, it's really infected, we need to amputate, we should culture, we should blah. But guess what? None of that matters unless you know what the owner's goal is. And this owner's goal was to keep this dog comfortable. He really didn't want to do surgery in a 12-year-old dog. So both Dr. Smith of Attitude and Yash both agree with me. I love that. So I said clindamycin is my antibiotic of choice for a possible deep bone infection. I think it has really great penetration. And anytime I have like a digit I think is infected or a deep abscess, I really like clindamycin. So I said we're gonna do 3 weeks of clindamycin and I wanna see it. And we might do another week after that. So I set him up already for additional antibiotics. And I said, based on his response, we may still have to amputate. But if we can get the swelling down and we can get him comfortable, then we are going to see if proper medical management works before we go to surgery. And this was at the beginning of all the sorry, I just read clindamycin on there. Yes, I love clindamycin too. This is at the beginning of everything going on. And so I also we were kind of trying to feel out like what was going to happen in the next couple weeks. He was very happy with it. He basically wanted to know that I was on the same page with him with the goal of keeping the dog comfortable, and that I understood that he understood that even if this was some ugly, nasty cancer and it was going to get worse, he was okay with waiting and trying something else first. Okay, so get on the same page with the owner of what the goals are for the pet and for the patient. It is not always what the gold standard is going to be. It is what you and them agree is going to be okay to try for this pet, okay? So we did 3 weeks of clindamycin, and he did his recheck in the middle of the pandemic, curbside drop-off, and I FaceTimed with him during that appointment, and this dog looked so much better. The swelling was down 70%. There was no more drainage or discharge. He said that the dog was happy, was running around. We did also do Rimadyl and gabapentin for pain. I did see Dr. Katie say pain meds of course, pain meds, yes. And this owner was so happy that we had gotten such improvement with just medical management and that the pet felt so much better. And so I didn't retake x-rays. I didn't do anything else extreme at that point. I said, we're gonna do 1 more week of clindamycin, okay? So 4 weeks total. We're gonna do 1 more week. You're gonna watch him really closely after you stop your medication. And then we're gonna see how he does. And if it just blows right back up, we might have to reconsider. Y'all, he went another week and I got the sweetest email ever of him with 3 children laying on him, the dog, 3 children laying on him. And he's like smiling in the picture and the kids are smiling, and the sweetest email with the owner saying, thank you so much for just really listening to us. Thank you so much for laying out the options. He is doing amazing. We're so happy. We're going to keep an eye on him. And we've already talked about if he starts to swell again, we might do pulse antibiotics. But as of now, we're not going to amputate. And this dog is happy and it's doing good and it's comfortable. So that would be my main take home with that case is don't just discount an owner's ability to maybe give you information that might be helpful. And also don't discount that just because they bring their own x-rays, they won't let you take additional x-rays as long as you communicate why you need to do them, what it is going to help long-term with, and it is going to help with prognosis. So that is a good example of identifying the owner's concern and the owner's goal. And that is always your primary thing. Yes, we want to help pets, but this is a business and we are having to interact with people, and that is one of the things that you have to learn to do also. So that is my case for this time. I will definitely have more cases when we do our next meetup. I'm going to be off Thursdays, Fridays, and I might do some Thursdays, some Fridays, depending on what the next couple weeks look like. Again, always available to you guys online. Make sure you go to my website. Dose of clindamycin used. I off the top of my head, I can't remember what I used. It's the broadest thing ever. Like you can use massive doses of clindamycin. I think I want to say I did a middle of the road dose. I feel like he was like I think he might have been a 70-pound lab, and I did 150 milligrams. I did 2 twice a day. But honestly, don't quote me on that because I don't have it in front of me. But clindamycin is usually really safe and really well tolerated, even at higher doses. And Derm uses it at pretty significantly high doses. Okay, this is so fun. It was amazing. My cup is full. I hope that it helped you guys some. I hope that one case helped. We'll do more cases. I will email you my PowerPoint just with the goals. And I really, really appreciate you guys hanging in there and helping and doing answers with me. I'll make sure to save this live because I know some people were in class and wanted to see it, and then reach out with specific concerns and ideas. Oh yeah, the Bettitude's coming in with the dosing, 10 to 15 mg per kg. Okay, hopefully that helps. I appreciate the other doctors that chimed in and helped out too. You guys are amazing. We're gonna get through this. It's a really crappy time. It really is. It's crappy for us in practice. It's crappy for you students, but we're going to get through this. And I just adore you all. So reach out if you need me, and I will see you next week. Thanks, guys. Bye.